I'm Savanna Cook, and my presentation is over the bovine viral diarrhea virus, also known as BVDV. The question I asked was, does the bovine viral diarrhea virus have direct effects on the reproduction performance of cattle? I'm going to start off by giving you a little background on the BVDV virus. It's a single-stranded RNA virus. It's part of the pestivirus genus and the family Flaviviridae. It is extremely widespread and is one of the most important diseases of cattle. It causes poor reproductive performance in adult cattle and a mucosal disease in calves. In addition, it causes immunosuppression and increased susceptibility to other infections, the impact of which is uncertain. This slide shows the two routes that the BVDV virus will take. The less common route, which is less than 10%, is where an infected cow becomes pregnant and infects the fetus. The most common route, which is over 90%, which is where a pregnant cow becomes infected and ingests the virus from any source. This happens at around 1.5 to 4 months of gestation. Unfortunately, in both cases, the calf becomes infected with the virus. Symptoms of the virus are fever and become dehydrated, nasal discharge, diarrhea, ulcers on hooves, and they are very lethargic. Here are some pictures of some cattle that are infected with the virus. This cow has ulcers on her nose. This cow is infected with the mucosal disease and has the mucus discharge. This cow has a severe case of diarrhea. And with calves, they will be born and will have no symptoms. They can look like normal, healthy calves. Once you release them into the rest of the herd, this is the most common way for the virus to spread and will become widespread before you even know it. The calf will have contact with many other calves and cattle throughout your herd. Following the acute infection of BVDV, suffering is mild. The risks are actually from secondary and opportunistic infections. As the disease weakens the system, many secondary infections attack the cattle. The virus acts as an immunosuppressant. It makes the body's immune system non-functional and allows bacterial infections to occur. Transmissions of the virus are vertically to the fetus, nose to nose, in the manure, or in the semen. Infected animals can shed the virus from discharge of the mouth, eyes, nose, or in the milk. The highest virus concentrations are found in the manure of infected animals with diarrhea. Many infected bulls also carry the virus in their semen. Infection in a pregnant cow may spread to the fetus, which can cause a number of different conditions depending on the age of the fetus. Vaccinations. Unfortunately, there are no specific treatments available for any forms of the BVD infection. All prenatal infected cattle will slowly die from mucosal disease, but animals that are infected after birth may survive. Antibiotics may help prevent the secondary infection. Natural exposure or vaccinations can be useful. BVD vaccines are obtained either as modified live vaccines or killed vaccines. Please note that critical reactions commonly follow the use of modified live virus BVD vaccines. Your local veterinarian must be consulted before undertaking any vaccinations or control programs. The effects of BVD virus are poor reproductive performance, reduced percentage pregnancies, increased abortions, stillbirths, or poor calf performance. Acute infections with the bovine viral diarrhea virus are dangerous in pregnant cattle because the virus can cross the placenta into the fetus. Fetal infections can result in early embryonic death, abortions, defects from the birth, or birth of calves chronically infected with the bovine virus. The BVD virus is not capable of long-term survival in the environment. To answer my question, does the bovine virus directly affect the reproductive performance of cattle, is yes. Studies show that it has a direct effect and that it has been successful in infecting cattle of all ages. This has made a major financial blow due to productive and reproductive losses. I found many great sites that gave great information about the virus and how it did directly affect reproduction performances of cattle. I hope you enjoyed this, and I hope you learned lots of information about the disease. So please come up with lots of questions, and I hope to answer them at our discussions.